Abuse of antibiotics in the last few years has been raising alarm to public health communities and doctors. It is impacting the treatment of many health-related issues, particularly in India, where antibiotics can be purchased off the shelf. Shweta Bajaj reports from Delhi.
Gangaram Hospital in New Delhi has the largest privately run microbiology lab in India. Here, scientists are busy evaluating if medicines, antiviral and antibacterial, are still effective in treating the bacteria they were designed for. Recent studies show that India has the highest resistance to new drugs, and much of this is due to the rampant use of antibiotics for common ailments. In India, antibiotics can be purchased off the shelf from any pharmacy. Researchers say the problem is so acute that if we do not act now, it will take only 5 to 8 years for antibiotics to stop working altogether.
According to scientists, as early as 2020 is when we can reach an era which would be anti-antibiotic, which basically means that anyone who actually has normal issues like cough and cold or even viral fever, on them antibiotics will not move. On a more serious note, issues like liver transplant, kidney transplant and more serious ailments will take much longer to recover from.
Dr. Chand Wattal is one of the top doctors in India who has been working on the overuse of antibiotics. He says it's the over-the-counter sales without prescription that has led to this acute problem.
We talk of antimicrobial resistance, particularly antibacterial resistance, and we have nothing in pipeline. That's the worst part of it. The companies do not want to invest in this resource because it gets soon consumed, and they even do not get their adequate returns as they expect. So why should they work on this kind of an activity, which is soon going to get depleted because of irrational usage? So if we irrationally use it right, left and center, we make these drugs redundant and these drugs stop working.
But despite the serious implications of the overuse of antibiotics, India's national policy on antibiotics is still under construction. The policy, put on hold in October 2011, included guidelines to ban over-the-counter sales of third-generation antibiotics in pharmacies. Shweta Bajaj, CCTV, New Delhi.